Doctors Without Borders, also known as MSF, is raising urgent alarm over a disturbing and persistent crisis in South Africa. Across Gauteng and KwaZulu-Natal, non-South Africans, including pregnant women, children, people living with HIV and other chronic patients, are being physically blocked from entering public healthcare facilities. Hello fervent viewers, welcome to another video. For weeks, anti-migrant groups have been camping outside hospitals and clinics, stopping people from entering no matter their legal status. They demand IDs, and if you don't look or sound South African enough, you are turned away. This isn't happening, or this is happening in a country whose own constitution guarantees healthcare for all. So MSF teams visited 15 hospitals and clinics in Gauteng. At more than half of them, they saw patients blocked by groups of 2 to 10 people. In some shocking revelations or cases, security staff and even healthcare workers were working with these groups. So we are asking the question, or we are seeking to identify as we highlight an example of a patient named Tando, 16 weeks pregnant and hypertensive, at high risk, went to the hospital knowing the dangers surrounding her situation and the health in total. A man waved his South African ID, telling those without the same to leave. And this saw nurses laughing and joined in saying, "You don't pay tax, we are tired of you," in quotes. Let's note that Tando never got care that day. So Tekla, a domestic worker also, living with HIV since 2008, now fears going to the clinic for her refill. The private alternative, over 500 rand for a consultation, far beyond her means. So we are checking a situation that without treatment, HIV patients face life-threatening risks, and the health system will even face greater strain when untreated cases resurface or worsen. So this isn't just the first time this is happening, because in 2022, Operation Dudula protesters blocked patients from Calafon Hospital until the government intervened. But today the blockades are spreading and thousands are being denied the care they urgently need. So what has MSF been doing all this while? It has been providing free medical care to vulnerable people in South Africa since 2007. And they are calling on the National Development of Health to act now. The message is clear. Clinics must be safe for everyone, police protection must be in place where needed, and communities must engage to fix healthcare challenges, not blame foreigners. So now let's visit the efforts that has been set aside to address the issue. The first being the development of Department of Health circular, where the Department of Health in South Africa has actually classified that refugees and asylum seekers are entitled to the same basic healthcare services as South African citizens. The Refugee Act of 1998 also stipulates that refugees have the right to access basic healthcare services in public facilities. And of course, the proposed National Health Insurance, which seeks to address the inequalities in the health system, but its implementation faces challenges. So we will leave you with this message. So please do like, leave a comment, and share, and why not come back for more insights on the story.